Hey everyone, welcome to my channel. Today we're talking about something super important for people with diabetes, looking after your feet. Taking care of your feet is important for everyone, but it's especially important if you have diabetes. Why? Well, diabetes can make you more likely to have problems with your feet, like nerve damage and poor blood flow. So, if you want to learn about common foot problems with diabetes and how to keep your feet healthy, stay tuned. Let's start with diabetic neuropathy. This is when the nerves in your feet and legs get damaged. It can cause tingling, numbness, or pain. Imagine feeling like you're walking on pins and needles or like your foot is asleep all the time. Neuropathy can make it hard to feel injuries like cuts or blisters because your feet don't tell your brain about the pain. That's why it's really important to check your feet every day for any problems, even if you don't feel anything. Look for redness, swelling, cuts, blisters, or any changes in skin color. It's also a good idea to see a foot doctor regularly, especially if your feet start to feel strange. Finding neuropathy early is really important. If you notice any of these things, talk to your doctor straight away. They can help you manage it and stop it from getting worse. Next, we have peripheral artery disease, or PAD. This is all about blood flow, or when there isn't enough of it. PAD happens when the arteries in your legs get narrow or blocked, often because of a buildup of plaque. Think of it like a blocked pipe. It's harder for blood to get through. This can cause cramps in your legs or calves, especially when you're active, pain in your feet, even when you're resting, and sores or wounds on your feet that are slow to heal. If you have any of these symptoms, it's important to talk to your doctor quickly. PAD makes you more likely to have serious problems like foot ulcers and infections, which can be hard to treat. Your doctor can do some tests to see if you have PAD and suggest the best way to treat it, like changing your lifestyle, taking medicine, or even having a procedure to improve blood flow. Foot ulcers are open sores on your feet. They can happen because of diabetic neuropathy, PAD, or both. They might seem small at first, but they can become serious problems if you don't treat them. Because neuropathy can make your feet numb, you might not even know you have an ulcer until it gets infected. That's why checking your feet regularly is so important. Look for any signs of ulcers, like redness, swelling, oozing, or a bad smell. If you see any of these, see a doctor right away. Treating foot ulcers usually means cleaning the wound, putting on medicine, keeping pressure off the area, and managing your blood sugar. Sometimes you might need surgery. Now let's talk about something less serious, but still important: fungal infections. High blood sugar can make it easy for bacteria and fungi to grow, so your feet are more likely to get infections, especially athlete's foot. You know the signs: itching, burning, redness, flaky skin, and sometimes even blisters or cracks. While they're not usually serious, fungal infections can cause bigger problems if you don't treat them, especially if you have diabetes. The good news is that treating them is usually quite easy. Creams, powders, or sprays from the chemist often work. But if it's bad or doesn't get better, see a doctor. They can give you stronger medicine. Finally, we have Charcot foot, a serious condition that affects the bones, joints, and soft tissues of the foot. It often starts with a small break or injury that you don't notice because of nerve damage from neuropathy. The bones in your foot can become weak and even break, changing the shape of your foot. You might notice redness, swelling, warmth, or pain in your foot, even if you didn't hurt it. Charcot foot needs to be seen by a doctor immediately. Getting it diagnosed and treated early is really important to stop permanent damage. Treatment usually means keeping your foot still so it can heal, controlling your blood sugar, and sometimes surgery to fix the shape of your foot. So, there you have it, 5 common foot problems that can affect people with diabetes. Remember, knowing about these things is really important for your health. By understanding these conditions and looking after your feet, you can lower your risk of problems and keep your feet healthy for a long time. If you like this video, give it a thumbs up and subscribe to my channel for more videos on diabetes and staying healthy. See you next time. Take care.